Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Aaron Sheedy, COO of Xealth, a digital health prescribing platform that enables easy integration and prescription of digital health tools from within the EHR workflow. Aaron was previously COO of Swipe, the smartphone touchscreen keyboard company, which was acquired by Nuance. Welcome, Aaron, and thanks for joining us.
Yeah, thank you, David.
So could you give us a brief introduction to Xealth and what you're doing, what you're trying to do?
Yeah, absolutely. So kind of an interesting, genesis story for us. We, as you said, came out of Swipe, sold that to Nuance, and when we finished that time there, we were looking around for the next thing to do. Mike and I have done several startups together, so we decided to keep going on that track, and we're lucky enough to get introduced to Rod Hochman, the CEO of Providence St. Joseph's, and he said, "Well, what are you guys doing next?" And we said, "Well, we don't know. We're looking for some other concepts." And he said, "Well, come join us at Providence and see if you can come up with some interesting technology solutions to help us improve our hospital." And we thought that actually sounded really, really interesting. We didn't tend to have a background on healthcare. My wife's a doctor, but other than that, that was the breadth of my healthcare experience. So under his guidance and then under Aaron Martin's group at Providence, we got exposed to IT and IS staff and the hospital system operations, the C-suite, clinical leaders, and that really helped us synthesize what the Xealth platform does. And our observation was that there was a tremendous amount of energy around trying to digitize the things that doctors and clinicians do on an analog basis. But even with that initiative, it just seemed to be taking quite a long time. There were lots of pilots running. Pilot with the diabetes app, a pilot with the mental health app, a pilot on videos that were custom built by an oncologist. And it just didn't seem to do a very good job of getting to scale to help the broadest possible patient base and help the broadest possible clinician base. And so what we recognized is that there was just kind of a missing software layer, interface layer between the EHRs and this digital health ecosystem. And so we built Xealth, and it helps digital health assets get integrated more efficiently into the EHR to be able to get some data in and out that shows what the patient might need or what the patient's clinical condition is. It's an interface that sits in front of the clinician that lives inside of their EHR, so they don't have to switch screens. They can go right in and see what asset might be relevant to that patient based on their clinical condition, and we deliver that asset to the patient portal that the hospital system already has built. So we're not taking them to some additional destination, so the patient gets an efficient way to view that content right inside of their existing patient portal. And then finally, because we deliver those three things, we can sort of tell, well, how did the patient do? Did they download the app? Are they still using it? Did they read the article? Did they watch the video we sent? Are they using a device? And is that device spitting up data that might help guide the next step of patient care? And that is both the genesis and sort of current state of Xealth.
Okay. So in terms of reading that information, so to speak, getting a sense of where the patient is on the patient's journey or adherence, if you want to say that, to the program, so to speak. How does that then get connected to the clinician? Are there triggers that generate messages to clinicians so they can loop back and follow up with the patient if somebody has read the article or has not read the article or has done something else through one of the tools that is prescribed?
Yeah, no, that's a great question. So there's a couple ways we do it. So one, we have the digital care interface that lives inside of the physician's charting interface. So if the patient is coming back in for another visitor in a few weeks, the clinician can click on our monitor view effectively, and that allows them to see the actual patient utilization. So if I've sent an article, for instance, about hypertension and what it means and how you should change your lifestyle, and the patient's coming back in for a checkup on that, I can see whether the patient read that article or watched a video about that. And that just helps me say, like, hey, okay, well then you read this or you watched it. Can you make any, should we have another conversation? What don't you understand? So sometimes it's just better care because we sort of have a good understanding about where the patient is on their knowledge. Other cases, it might be a little more important, right? Did the patient read the checklist of things that they're supposed to be bringing in for their surgery the following morning? And if they have not consumed any of that stuff, well, it might be time to maybe pick up the phone and say, hey, let's make sure you remember to stop eating, or we should send another reminder to stop eating. And so we can try to keep these patients on track, pre-op, post-op. And when it's a much more acute scenario, like the patient's gone home from a procedure and we feel like they're not doing very well, we can enable partners in the digital health ecosystem to, just as you said, put an in-basket message back into the specific pool so that the care team could reach out and say, hey, you might not be doing very well. How's the wound look? But we can try to digitize a lot of the front end of that experience so that we save those person-to-person interactions for when they're really needed.
Okay. So as I'm listening to what you're saying, I hear you describing an effort to bring healthcare into the consumer world of apps and smartphones, so to speak. So in a way that allows people to interact with healthcare as they interact with the rest of the world, sort of in the same language or in the same idiom, so to speak. And I guess the question is this working? Are you putting yourself in a situation where you're competing against Amazon or other consumer products and services, or is this in fact just the best way to reach people these days?
Well, certainly, I think it's the latter. There's a little bit of the former too, so I'll talk about that. But the latter piece of it is really the hospital. I mean, our customers are the hospital systems themselves, right? I mean, you have a business that is experiencing a significant reduction in margin year over year. So most large hospital systems and medium-sized hospital systems are working to try to provide equal or greater levels of care with potentially diminishing reimbursement, especially if you look across the entire landscape of the patients, from Medicare, Medicaid, commercial. So in any environment where that's the case, and in an environment where the most expensive thing is people, you want to enable those people to serve the broadest number of patients with an ever improving, quality of care. So that's always a good recipe for trying to digitize things that you're doing on an analog basis. But I think that it really is also true that the consumers themselves have an expectation for things being able to be digitally accessible to them, right? The fact that a lot of the care plans that are delivered to patients to go home and do exercises after, even a basic knee operation are handed out on paper that might have been photocopied 10 times. They require lots of printing. They require people to store it. They require nurses to grab it from the file cabinet and hand it to the patient. That's both inefficient and ineffective. So, and we can't track it, right? We don't know, well, does the patient actually do any of those exercises? Did they leave it on the floor of their car? And so I think patients are asking for more digital interactions, and I think the physicians and clinicians are ready to give it to them. And I hope what we're providing is the toolkit to help bridge those two expectations in a way that doesn't change the way clinicians work today and doesn't change where patients want to get their care, which is from the hospital system itself.
Right. Now, you've come at this from a non-healthcare background, if I understand correctly, and I'm wondering how you're making that transition, or how that transition is working for you, and sort of dealing with the crazy mixed up world of healthcare and the whole variety of layers of regulation, whether it's data privacy and security or other sorts of things. How does that figure into the development of the toolkit that you have?
Yeah, no, well, quite a bit, obviously. I mean, I think we very intentionally chose hospital systems as our target customer, right? And the reason why that is because we had a strong thesis that if you want to change the arc of someone's health, it really needs to involve the clinician. There are moments in time people are sitting down in front of their primary care doc or in front of their their specialist, and when that person, the trusted individual, says, hey, what you need to do is you really need to get a handle on this challenge that you're having. I think that's a moment where you can change people's decisions about how they want to live their life, how they want to change their eating habits, how they want to exercise, whatever it is that's going to help change their trajectory. But we felt like it was so hard to intersect that point in time, right? Because it's tight, right? You have 8 minutes, you have 12 minutes in front of patients, and nurses are burnt out and really struggling to get the stuff done they want to get done. Clinicians are the same boat. So we embraced, as you just said, the challenges, which are, the EHRs aren't necessarily designed to interface very effectively with third-party ecosystems. That wasn't really how they were originally architected, so that was its own technical challenge. Patient-facing interfaces today aren't necessarily built with the idea that there might be more than a few types of things looking to interact with that patient, but to extend care. The regulatory environment, I think
you're a master of understatement there.
Well, yeah, that's true. It's true. We, I think we're trying to unlock some of these things that sort of feel like they might be a little bit too, sort of maybe too closely held. And thirdly, while there's a big expectation on digitization of things, I think there's also a highly variable sensitivity among the patient population around the privacy and security of their data. And that's another reason why we chose very intentionally to integrate as many of our interfaces into the existing health systems, patient portal or patient experience, whether it's a mobile app or whether it's a web app. If you're trying to digitize your ecosystem of clinicians and patients, you need those patients to be digitally engaged with you via the tools that you have, and that's the major EHR patient portals, which are rapidly improving. They can communicate with your physician. You can do more scheduling. You can seek out more types of care. And I think as those continue to grow, we felt like building an interface layer that lived right alongside of that lived inside of that patient experience, both met the security and privacy concerns of people and also met the business goals of the hospital systems, which is to build loyal patient relationships with their digital front doors. And so I think we tried to embrace all of those challenges that healthcare uniquely brings across regulatory and technical and workflow complexities, but try to turn those into assets that Xealth understands how to work with, and
Right.
hopefully can, as we said, help patients and clinicians be better connected.
Right. So you're if I hear you correctly, you're white labeling your product or portal within an EHR or PHR provided by the hospital?
Yeah, that's right. I mean, from my perspective, success for us is to have a greater percentage of patients, actively engaged with our customers' hospital systems portals, right? That if you want to succeed in any given urban market where, increasing competition for patients from hospital systems is becoming more top of mind, we feel like Xealth provides the framework to have patients really meaningfully say, like, oh, if I'm not feeling very well, or if I want to check up on something about my health, I shouldn't start with Google. I should start with my hospital systems, my BSW or Duke's portal or Providence's portal, and that therein should be my starting point for care.
If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and my guest today is Aaron Sheedy, COO of Xealth. So, Aaron, you were starting to talk about the value proposition, so to speak, in terms of improving both engagement and ultimately health of patients who are connected to healthcare systems, hospitals, and are using the tools that you provide and that you pull together for them. Have you done any sorts of measurements? Can you share any particular data points around engagement, health improvement, anything else?
Yeah, we can. I mean, one of our favorite use cases is from our partners at University of Pittsburgh Medical Center. So UPMC launched us several years ago now, and we've gone across several different service lines. We've done some orthopedic work, we've done some maternity work, we've done some other surgical procedures. But maternity is one that we were really proud of. We were working with Dr. Updike over there, and just before Xealth was there, they already had a very strong sense as to why it is that focusing on a maternity population is so important. If you can start your life healthy, it helps to put you on the right trajectory. So reducing adverse events, increasing the ability for high risk moms to have good outcomes is certainly just good for your overall broad care. But in addition, moms end up making a lot of healthcare decisions. So if you can have her get a really fantastic experience from pregnancy to pediatrics, she'll probably start making decisions about care. And if she feels like in this case that she really is a UPMC patient, then there's actually quite a bit of value to be gained in having her interact with your system over and over again over the next 18 years. So they had a very robust set of assets that they had pulled together in a maternity bundle. So that was a series of videos, one for each month of the pregnancy journey. They had a list of maternity classes that they wanted deployed to every single mom so that she could get a sense of what's near me and when do I go and what's the subject, and then a newsletter which would come out once a week via email that would say, okay, here's what week 36 is like, and here's what week 37, and here's what you can expect. So that work all was there laid in before Xealth showed up. And the challenge, of course, was that work sat on the back of the MAs and the nurses, right? They were running around trying to find all these assets, clicking through a drop-down list in the EHR, like, oh, there's the video. Oh, not that one. No, here it is. Okay, that's the one. Yep. And then getting the class schedule from basically underneath the counter. And oh no, this one's from spring. It's actually fall, right? So and then the newsletter was a third-party website. So that work was taking a lot of time, which meant that they weren't getting as much engagement either out of their clinicians or out of their patients as they wanted. And so when Xealth came into the mix, we basically turned all that into one click because we live in the clinical interface. We can see where the mom is in her journey. We can recommend to the clinician, like, hey, she's entering her second trimester. Here, click this button. We'll send that bundle out. We delivered that to UPMC's own patient portal. So at the end of it, we were able to drive up to 93% of all moms were engaged at some point during that journey with some of these digital assets. So at UPMC's level and at our level, we were just thrilled with that kind of an engagement. We were getting, a lot of clinicians to use it because it was so easy and it saved them so much time. And we were able to get patients to use it, which is really the driver. And then so from there, we're now looking to expand across other service lines. I mean, you can imagine that lots of service lines have the same sort of multi-vendor, multi-asset bundle of content and assets that are wanting to be delivered to patients over a series of clinical triggers. And so we're very enthusiastic about that outcome.
Let me step back and ask you something that maybe we should have started with, which is to talk more generally about what is it that we mean? When you say digital health tools, what is it that you mean? You described some stuff just now that's sort of a combination of what we might have expected in the past to be print plus video plus email plus something else. I'm thinking that this could also include a variety of digital health apps and a variety of what people call digital therapeutics. I'd be interested to understand, how far the range of items that you offer through your platform extends.
Right. Yeah. No. That's a great question. We have a lot of fun with that one because it changes a little bit every week, I think.
I'm sure.
but with that in mind, my opening statement would be I can't wait until even the term digital health seems, kind of hopelessly anachronistic, right? That we don't talk about a digital travel experience or a digital booking. We don't talk about digital lots of stuff because it's just assumed that the digitization of something is part of having it be functional and usable and part of our everyday existence. So I can't wait until people are like, haha, remember when we called it digital health? That was so cute. But anyway, notwithstanding the fact, we now sort of feel like, look, it is the sort of stock standard patient education assets that sort of live in the hospital systems, quite frankly, thanks to a lot of meaningful use stuff, which is, articles about a condition, videos now more recently, and videos that have been produced not just by third-party vendors, but also by the hospital systems themselves, because it's so cheap to shoot and store these things. We see quite a few systems investing, I think very positively in physician-created content that really helps patients feel like it's a personalized journey for them, whether it's in oncology, or whether it's in a significant surgery. So the fact that health systems are producing these assets now need a place to live, and Xealth is a place to help get those both prescribed and hosted and ultimately delivered to the patient. So those are sort of our two basic content categories. And then I think we certainly saw the app ecosystem. There's a lot of work being done on diabetes prevention. There's a lot of work on perioperative surgical pathways and helping patients sort of understand, okay, here's this journey, from getting ready for surgery and then, weeks or months of recovery and all of the things that you need to be doing. And those are apps that are designed to help you walk through those things as well as mental health, which is another area that I think, recognizing the lack of clinicians that are available on a timely basis to help intervene with patients. Are there ways in which we can intervene early with apps that help people generate habits that will help them stay healthier? So those are the first three categories that we had when we started our Xealth journey. But then we quickly found other areas that to us were just adjacent to digital health. So, as we talked about at the outset, devices. The amount of data that's being generated by devices people are either wearing or carrying around with them or using at night, like CPAP machines or, A1C readers. Those data sets have a tremendous amount to say about the patient's trajectory of care. And so we've done a couple of device interactions with our partners at Freighter, using Gluco to help send that data back into the physician's interface so that they can see how a patient's doing on an A1C reader. And at Providence doing CPAP machines. So patients that are on CPAP machines, sleep docs or primary care physicians can come and look and say, hey, well, how are you doing? Are you using this? Of course, that's especially true if the patient's about to go through some other health journey, that maintaining their compliance on CPAP is a trend. So there's devices. And then from there, we were like, well, wait a minute, there's even more than that. There's, our use case that we launched last year where we're enabling clinicians to send a piece of a recommendation around things that the patient might need at home to recover from surgery. So if they're coming in for, a knee replacement, then they'll need, some gauze and ice packs and, exercise bands and some, wrap and a whole sort of series of things. And they tend to hand these things out to patients in the post-surgical suite, and like, well, here you go, here's all the stuff you want to have. And some of that they can take to the DME and have it be reimbursed. Some of that they might have to go down to a retailer. And rather than going through that process, we thought, well, why don't you just have that dropped off at your home before you even come home from surgery, preferably. So our world of what's digital health has grown significantly to include those types of things, and even to food delivery, in helping patients recover from surgery. If they don't have access to fresh food, their ability to recover, it's not an app. That's not going to help. But food will help a tremendous amount. And so enabling clinicians to order the right thing for the patient that they need, based on their care condition, I think is continuing to broaden out beyond what we would sort of traditionally consider digital health.
So all of these things, I imagine, can be customized by a particular hospital customer of yours?
Yeah, we really treat ourselves as kind of, we take what the clinician leads want to do, and we try to embody their will in our algorithms and rule sets. So we sit with them. They say, okay, when we have a patient coming in with these clinical conditions and in this demographic, here's what we really want to try to, get them hooked up on. And so we try to write the Xealth, algorithms to abide by their rules. And when there's multiple rules, right? So patients obviously have a lot of, comorbidities. So you might have a patient who's both, hypertensive and overweight and a little bit depressed and has diabetes. And the order in which you want to tackle each one of those things varies. And so you give the clinician the opportunity to use their best judgment based on where they think the clinician is, but or where the patient is. But we can at least present that right there in one interface to the clinician so that they can, quickly and efficiently make a decision.
So do you see any changes in the way that your customers use your tools coming down the pike in the future?
We do. Yeah, that's a great question. So one of the original theses, as I talked about at the beginning, is that, there's this moment in time where clinicians and patients are sitting in front of each other, we hope, and like, okay, well, here's the thing we're, really going to tackle today, and here's some tools that can help you do that. That's true, and we see very high uptake in assets when we get that conversation to happen. But we also recognize that there's a lot of stuff that can happen before the patient even shows up at the front door of the clinic. So we're looking at surgery schedules, and we can see patients coming in for certain visit types. And based on those visit types and other clinical conditions which we can read, we can say, oh, well, hey, this patient's coming in for a consult around bariatrics. And so here are the assets that the clinician wants that patient to consume before they come in so that they can be best prepped for that visit, whether it's a consult or an actual procedure itself. So that's been a really interesting evolution of our system, because we now are able to lift work off of the clinicians, pre-procedure, and they can say, okay, great. Well, I can now see if the patient's consumed any of this stuff. I didn't have to have any of my frontline staff go click, click, click. And so that just frees up a little more time so that when the patients and the clinicians are together, they can spend it, more hands-on and less kind of reviewing education stuff, which if they know the patient's already consumed it, that can be a good cost saver and actually increase the kinds of things that we all consider to be high quality care, which is, more time and more face time.
So to wrap things up, Aaron, my lightning round question for you is this. If you were to wake up tomorrow and find yourself 5 years in the future, what is one thing in healthcare that you would hope or expect to find has changed drastically?
Well, that's a good one. Okay, so let's see. Well, one of the ones that we're chasing, and I think this would be fascinating to sort of see if we can pull it off, is, oftentimes clinicians and patients and doctors, when they're interacting, the compensation for doing the right thing for the patient over the long haul often gets overshadowed by the thing to do in the short run, right? So taking care of somebody's diabetes is, and I hate to say this, is not always the number one focus of any given large hospital system, right? It's a long chronic condition. The compensation and reimbursement for hospital systems to manage chronic conditions are, why don't we say, not very well thought through. So one of our views is that if we can help connect up the assets that are being paid for the patient by their covered, by their covered plan, whether it's Medicare or Medicaid or a commercial insurer, and I know a patient coming in qualifies for telepsych or qualifies for diabetes prevention, and that is being paid for by their employer or their payer, I think that if we do our jobs right, or if lots of folks do their jobs right, we can actually create very good incentives and efficiencies in getting clinicians the tools that they need to prescribe for the patients the assets that really help them control their health and their outcomes over the long haul. So that's one for me that I'm really looking forward to.
Great. Well, thank you for joining me, Aaron.
All right, David, thank you. It's been a pleasure.
You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.